On the inside of this truck, you have two portable oxygens that will always be here. These are both D cylinders. So if for some reason you do need extra oxygen while you're in the ambulance, then you have these cylinders here. The regulators go on top and stay on the tanks at all times. So they haven't been put on in this truck yet, but they will before we put it in operation. The other thing that we have in this truck is in the rear we have a fire extinguisher. And LB2 is located in the wheel well right here, and LB1, the fire extinguisher is in the wall. Both places should be easy to access and close to an exit, so that you can work quickly and out quickly. The other thing on LB2 that is different from LB1 is we have a wet storage compartment here. So if for some reason you do have anything that's wet, or a rag or anything like that that you don't want to dirty the truck, or as cleaning supplies, you can put that in here. This cabinet actually has a drain in it, so any kind of water or anything like that will drain out, even though it's put in from the inside. Might stay. All right. The other thing on this truck that we have is captain's chair here, which it has a built-in car seat. So you can pull down on the captain's chair, and that provides you access to the car seat. So if for some reason you have a child that you don't want to ride on the stretcher or does not necessitate that care, then you have the ability to transport them. You'll want to refer to our policy and procedure manual in terms of transporting parents and family members. Our policy is we try to limit to one parent or family member just because of limited space and so forth. And when we have them, the state really pushes the best thing is for parents and so forth to ride up front, just because it's safer. It's they can wear a seat belt, they're riding forward facing and so forth. And the other thing is that doesn't interfere with the medical crew providing care in a cramped space. So we do, we say that that's the best thing to do. However, you as the medical crew collectively have the ability to make the decision of whether or not there's a patient condition, or the patient acts better when the parent, when mom or somebody is around. And at that point you do have the option of allowing them to ride in the back. Anytime a parent rides, they must be seat belted in. All of our seats, including in the back, have seat belt capability. And whether they ride up front or in the back, they have to be in a seat belt to ride in the ambulance. The patient also must be properly secured, whether it be to a PD mate, to the stretcher itself, or in a car seat. You cannot transport a patient that's not properly secured. Children that are not patients, we try not to transport, just because of extra liability. That puts us at, we basically become responsible for those children. We're not set up to carry more than one child. We've got the car seats and so forth for the one. We don't have that capability for multiples. Putting car seats in these chairs and what have you is not safe because of the direction that they're riding and so forth. So this ambulance, we have airbags in the front. It's not set up for them up there, and it's not set up for them back here as well. Okay.